Yes, perfect.
All right, perfect. Well, Judith, thank you so much for that kind of introduction. And thank you all for joining us today for our discussion. So what we're going to talk about today is COVID-19 versus influenza in 2020, a very timely topic for us all. Regarding disclosures, I'd like to acknowledge funding support of our Washington University Geriatric Primary Care Clinic by the Missouri Foundation of Health. And I'd like to thank Steve and Cohen for helping to arrange the event, Susan Kempinen for getting the word out through social media, and Judith Oliver for her kind technical support prior to and during this presentation as well. So first of all, let's go over objectives of what we'll be talking about today. So first, we'll look at background on COVID-19 and influenza. And that's going to include some statistics as well. And then we'll look at risk factors, transmission, and prevention strategies. After that, we're going to examine signs and symptoms of both diseases, testing, as well as treatment options. That's going to be followed by warning signs. So when do we need to go to the emergency room? When are things a problem? We'll look at common questions that have come up recently. And finally, we're going to be looking at what's on the horizon. So I'm starting out with a cartoon by Dave Granlund, and it really is showing what we're concerned about. So with flu season coming on board and the issues that we've been having with COVID-19, how do we prepare for this potential perfect storm? And where do we go from here? So first, starting off with a question, very simple, true or false? Influenza and COVID-19 are diseases caused by the same organism. So as I'm sure all of you know, that is false. They are caused by different viruses. They are both respiratory illnesses, but the actual cause is completely different. So COVID-19 is a disease that's caused by something called the novel severe acute respiratory syndrome coronavirus 2. So it's a long name, it's abbreviated SARS-CoV-2. Influenza, on the other hand, also a respiratory illness, but that is caused by influenza A or B viruses. And influenza is actually mainly seen during the winter months, but we're going to be talking a little bit about that in the next slide. So just a real brief history on COVID-19 as well as influenza. So COVID-19, we first began to see this back in December of 2019. So only 11 months ago, actually. And it was first recognized in China. China actually alerted the World Health Organization about a group of patients with pneumonia of unknown cause in Wuhan, China. By January 7 of this year, the World Health Organization officials, they announced the identification of a new coronavirus. The following week, they actually had the first confirmed case outside of China. It was a traveler from Thailand who had visited Wuhan that had contracted this illness. By the following month, in February, the disease that was caused by SARS-CoV-2 was named COVID-19. By March, so the following month, March 11, 2020, the World Health Organization declared the coronavirus outbreak as a pandemic. And by April 1st of this year, we had already confirmed over a million cases. So it's pretty remarkable how quickly this disease has progressed. In terms of influenza, we've had a longer history with influenza. It was actually first isolated in the lab back in 1932, but the history can actually be traced back for actually 300 years with some certainty. And so they've looked at signs and symptoms of influenza and realized that it really has been around a long time. We see annual epidemics that result from the fact that this virus actually mutates, and it has mutations of the surface proteins. And when these surface proteins mutate, then it causes these annual epidemics that we see of flu. But in addition to that, we have seen pandemics of influenza as well. And that's when you have major virus reassortment. And when we see pandemics, these actually start off in a specific geographic area, and then they spread throughout the world and they infect millions of people, cause a tremendous number of deaths. Since 1590 AD, we think that there were probably about 10 probable actual pandemics and 3 possible influenza pandemics. The influenza pandemic in 1918, 1919 was probably one of the most dramatic events in our medical history. The first outbreaks of that were actually seen in North America. They were seen in Detroit, in South Carolina, and actually at San Quentin Prison. And in North America alone, there were 600,000 deaths as a result of what was known as the Spanish flu. And unique to that pandemic, it's interesting because the deaths that occurred with the Spanish flu were principally in the group of ages 20 to 40. So that was a bit different from the past known pandemics with regards to influenza. With influenza, with that particular pandemic, it infected 50% of the world population at that time. 25% of the population actually suffered a clinical infection, and the total mortality was 40 to 50 million. So just a devastating pandemic. So getting back to COVID-19 and the state of our affairs right now, Johns Hopkins University actually has an excellent website called the Coronavirus Resource Center. And this is continually updated, and it actually has statistics with regards to cases globally, cases within individual countries. It looks at death rates. So it's actually a very, very interesting website to look at. This data that I just took a screenshot of, this is actually from this morning. And so in terms of global cases of COVID-19, we're up to 48 million. And the next slide, we're going to be going over in the United States, kind of drilling down to the specifics within the United States. Global deaths were up to 1.2 million at this point. So looking specifically at the statistics in the United States, so as of yesterday, the number of cases in the United States was up to close to 9.4 million. The number of deaths was above 230,000. The graph below the data actually shows the troubling, concerning trends with regards to COVID-19. So it's showing that we're hitting another peak with regards to the number of new cases that are accumulating. The next graph after that shows that in addition to the number of cases going up, we're also seeing an increase in terms of the deaths per day as well. So as for influenza, we do have a little bit of good news in that right now, seasonal influenza activity continues to stay pretty low. So right now, compared to kind of the national average, usually outpatient visits, we should see about 2.6% of outpatient visits being related to influenza-like illness. But right now we're down to 1.2%. In addition, specifically when we're looking at testing, the rate of positive tests for influenza in the clinical laboratories is actually it's still at 0.2%. So it's pretty low, which is the good news. This actually looks, going back to COVID-19, it looks at the cases that have been reported to the CDC in the United States, but it's split up based on the individual states. And what it does show is, unfortunately, Missouri is at number 10 right now. So this is not something where we want to be in the top 10. And especially concerning is looking at number one is, of course, our neighbor, Illinois. But the number of cases that we're seeing in the United States, the number that are, the amount that they're increasing, the rate of increase is definitely something that is quite concerning to us. Now, these are some statistics with regards to Missouri. So kind of drilling down to our state, you can see on the left-hand side, in terms of daily trends for COVID-19 cases that have been reported in Missouri, you're seeing that definitely the trend is going up. The two graphs on the right-hand side look at the cumulative rates in Missouri with regards to cases. And down below is the rates in terms of COVID-19 deaths. So definitely some really big concerns in terms of the progression. As of November 2nd, in Missouri, we actually already are at 190,000, over 190,000 cases with over 3,000 deaths. In St. Louis County, we've seen over 32,000 cases and close to 900 deaths. In St. Louis City, we're at 8,900 cases and 225 deaths. And now comparing to how things are with regards to influenza, when we look at the United States as a whole with influenza, we do see that our rates right now seem to be quite low. The yellow one above us is Iowa, so they seem to have a little bit of increase, but you're seeing a lot of green, and green is good. Green means minimal activity, so that is reassuring. And then the graph below actually shows the kind of the influenza positive tests that have been reported. So the big kind of hump on the left-hand side is actually looking at the data from this past season. So we definitely had a significant number of influenza cases during the 2019-2020 season. Right now, the numbers seem to be pretty low. So next, we're going to be talking about COVID-19 and influenza and who is at high risk. So there's definitely an overlap in the populations that are at high risk for COVID-19 and influenza. So in both, we're worried about the older population. And so that's usually defined as people 65 years of age or older. With COVID, there are many chronic medical conditions in adults. So not only the older adults, but adults in general that are putting them at increased risk of severe illness from COVID-19. And those conditions include cancer, chronic kidney disease, chronic obstructive pulmonary disease, so COPD, heart conditions, so heart failure, coronary artery disease, cardiomyopathy, people that are immunocompromised from having solid organ transplants also at increased risk, obesity and severe obesity at any age are considered as risk factors in terms of COVID-19, sickle cell disease, smoking, so kind of along the same lines as your chronic obstructive pulmonary disease, and diabetes mellitus as well. When we look at influenza, again, like I had mentioned, people above the age 65 and older are definitely at higher risk. Chronic medical conditions in general are going to put you at higher risk for influenza as well. So asthma, diabetes, and heart disease are three chronic medical conditions that are frequently quoted in the literature as being concerns. But in addition to that, then with influenza, we worry about our pregnant women, as well as children. So question 2, so true or false? So one person infected with COVID-19 can likely infect 2.5 other people. So this is actually true. So what we're looking at here is as you can see on the little chart below, is the R naught. So we're looking at how contagious a virus is. So that means how many people are likely to get infected by one sick person. So with COVID-19, the rate is about 2.5 people being infected by one person. Of course, that can vary from individual to individual. We know that asymptomatic infected individuals can still spread the virus to others. The way that it's transmitted with actually both of these diseases is through respiratory droplets and maybe some aerosolized transmission as well. With regards to the respiratory droplets, so how are those been created? So that's from things like coughing, from sneezing, from singing, from talking, or even breathing. So all those things where we're moving air back and forth and can move those respiratory droplets. So much less commonly, it could be contracted through contact with contaminated surfaces. And that's one of the reasons why we do keep on telling everyone to, clean any surfaces that are being used often. And that's also the other big reason why we need to make sure that we keep our hands away from eyes, nose, and mouth, because that's how we're going to contract it if we come in contact with it from a contaminated surface. And like I said, in terms of influenza and COVID, both of them are, as being respiratory viruses, the transmission is through the respiratory droplets, and that's the main way that it is actually transmitted. Looking again at the little chart below, while COVID-19 has an R naught number of 2 to 2.5, flu is, it is obviously still contagious, but the R naught number for flu is at 1.3. So it's definitely less contagious than COVID-19 is. So the question always comes up of, so when am I contagious and when do the symptoms actually appear for both of these diseases? So with COVID-19, you can see that the incubation time, so the time from when you get exposed to when you first develop symptoms, is a lot broader than it is with influenza. So for COVID-19, it can be 1 day, but it could be up to 14 days. And on average, it's probably around 5 days for an incubation time. In terms of influenza, the incubation period is more along the lines of 1 to 4 days, and usually you start presenting with symptoms around 2 days. In terms of how long people are contagious for, with COVID, with mild to moderate disease, in general, people remain infectious for probably about 10 days after their symptoms have started, which is why we talk about that 10-day quarantine period. But with severe disease, or if you're severely immunocompromised, people can actually potentially remain infected for even up to 20 days. So that is an important point to realize as well. With influenza, you can get infected for probably about up to 5 to 7 days after you start to present with symptoms. So there is some difference between the two illnesses. So this is our next question. So with COVID and influenza, both of them can cause you to lose your sense of smell. So true or false? So this is actually false. There are a lot of overlaps between the two diseases in terms of signs and symptoms, but this new loss of taste and smell seems to be seen in COVID-19, and we don't see it in influenza. So what do we see in both? So if you kind of go down the list, lots and lots of overlaps. So fevers and chills, cough, sore throat, congestion, runny nose, the muscle aches and pains, headaches, and fatigue. And both actually probably do have some, depending on the severity of the illness, you can get the shortness of breath and the difficulty breathing as well. The gastrointestinal symptoms, those can sometimes be seen with COVID-19 as well. So the nausea, the vomiting, the diarrhea. For influenza, the vomiting and the diarrhea that we sometimes do see is usually seen more in kids and not as much in our adult population. And like I had said with COVID-19, there is that sign and symptom of that new loss of taste and smell that does come up. One useful site is through the CDC, is that they actually have a coronavirus self-checker that you can go online and look at. So if you have concerns about some of the symptoms that you're having and just kind of want to see if this is something that you should be concerned about, it's actually a quick way of kind of running down the symptoms, going over the symptoms and kind of seeing if it could potentially be something that you should be concerned about. So when do we go to the ER? So all those symptoms that we're talking about are definitely things that make us feel awful, but when is it really something where we should be saying, you know, I need to have some medical help and I need to go emergently to get medical help? So with COVID-19 and with influenza, there are a number of reasons why you should be heading straight to the emergency room. So if we're having difficulties with breathing, shortness of breath, then that's definitely a concern. Persistent pain, pressure in the chest or abdomen, also another reason. Persistent dizziness, so changes in terms of your cognition. So new confusion, if you're having problems awakening someone, if they're having problems staying awake, bluish lips or face. So in that case, you're worried about problems in terms of their oxygenation, if they're not getting enough oxygen in their blood. Seizures, obviously an emergency sign as well. Not urinating, so if there's a problem with dehydration. Severe muscle pains and severe weakness or unsteadiness. If you're having a fever or a cough that improves, but then it comes back and it's worsening. And then finally, if you're noticing worsening of your chronic medical conditions, then that can be a real warning sign as well. So say your diabetes starts to go out of control, that could be a big problem and a reason why you should be seeking immediate emergent help. If you're having more problems in terms of, say, your asthma, you're using your inhaler a lot more often. If you're having problems with your COPD and you're getting your nebulizer and you're just not feeling better, say your oxygenation, if you have a little pulse ox device and if that's showing that your oxygenation isn't getting better with your normal medications, then those are all reasons why you should be heading directly to the emergency room at that point. So how about in terms of testing? So who is supposed to be seeking testing? When do we go and get those nasal pharyngeal swabs? So with COVID, if you have symptoms of COVID-19 that we had just talked about, that would be a very important reason to have a test done. If you've had close contact with someone with confirmed COVID-19, so we in general say within 6 feet for a total of 15 minutes or more. Now, Right now, they're also talking about, the fact that that 15 minutes might not need to be a continuous 15 minutes, but if it's 15 minutes over the period of 24 hours cumulatively, then you should be going to seek testing. And then there are going to be people that are going to be asked, referred to have testing done by either their healthcare provider, even the local or state health department may ask you to seek testing. But it should be known that not everybody does need to get tested. If you are getting tested, we do recommend that you self-quarantine at home until your test results return, because the last thing you'd want to do is find out that you've tested positive, but that you've gone out to dinner with friends the night before. With influenza, usually the people that are seeking testing, just in general, are people that have the signs and symptoms that are suggestive of influenza, so very similar to the signs and symptoms of COVID. But there are some atypical presentations where people will get testing as well, things where you're worried that you might have complications that can result from influenza. So in terms of types of testing that are available, so with COVID-19, the viral tests that people are talking about, so either the nucleic acid tests or the antigen tests, so those viral tests are to tell you if you have a current infection. They usually use the nasal swabs, oral swabs, saliva. Those are the kind of ways of getting those secretions to be able to test for the virus itself. So when we talk about viral tests, that's asking, okay, do I actually have COVID-19? Do I have an active infection? Antibody tests that people have been talking about, those might tell you if you've had a past infection. They are not used to diagnose a COVID-19 infection, but they're saying my body has probably been exposed to COVID-19. I've built up a immune response to it. They also are not sure in terms of these antibody tests whether having antibodies means that you're protected or that you're protected long term. So there are still a lot of questions out there in terms of antibody testing. In terms of what does it indicate? What information do I get from it? For influenza, there are a number of flu tests that are available to check for the active infection. The ones that we most commonly see are what they call the rapid influenza diagnostic tests, and there are rapid molecular assay tests as well. And those have been around for quite a while, actually. More recently, they actually have come up with a test that checks for influenza A and B, as well as COVID-19. And this is actually being used by the US Public Health Laboratories. So just another little tidbit of information as well. So you have the signs and symptoms, you take your tests. What do? You test positive, but you have a mild illness. You're very, very fortunate and you just have a mild illness. So what do we do about that? So for both COVID-19 and influenza, we want to prevent, obviously, the spread of both. So the main things that are important, you stay at home, you stay in contact with your healthcare provider, make sure to stay rested. Hydration is very, very important. Especially with the fevers, and sometimes people have a decrease in terms of the appetite. It's easy for people to get dehydrated. Symptomatic treatment. So for your fevers, your muscle aches, you might want to take some Tylenol. You might want to take some non-steroidal anti-inflammatories. For your cough, using over-the-counter cough suppressants might be something to kind of help with your symptoms as well. Make sure that you separate yourself from other people, so including your loved ones at home, because the last thing you want is for the whole family to get infected. And really, when you're sick, you should stay at home unless you need to get medical care. Otherwise, everything else, other people should be helping you out at that point. So are there actual treatments though for these diseases? So with COVID-19, with mild cases, so you don't need to be hospitalized, or you're hospitalized but you don't need any supplemental oxygen, we actually, at this point in time, there are no antiviral medications, no steroids that are recommended. When we do get into the moderate and severe cases, so the cases where people are requiring hospitalization, needing supplemental oxygen so that they can keep their oxygenation up, and including if you need to be on a breathing machine, a ventilator. For those individuals, then the antiviral remdesivir has been approved by the FDA. In addition, they are actually using dexamethasone, which is a steroid. They're using that in the hospitals as well, sometimes with the antiviral, sometimes on its own if the antiviral can't be used. Now, there is good news with regards to influenza as well in terms of medications. So we do have prescription antiviral medications that are available. And these actually come in a number of forms. So there are pills, there are liquid forms, there's actually an inhalation powder that can be used. And for severe cases of influenza, there are actually IV solutions that can be used as well. Now, it's important to note that these usually should be started within 2 days of having flu symptoms, and they can help with the fever. They can actually help with your flu symptoms, and they can shorten the time that you're sick, but probably by only about a day or so. But importantly, they can result in more mild cases of flu. And they can also decrease your risk of complications. So especially like the respiratory complications, where you might get a superimposed bacterial infection that requires an antibiotic, or where you get so much shortness of breath where you need to be hospitalized. So they may decrease the risks of those possible problems as well. So one thing that you may have heard about is contact tracing. So what exactly is that? So this is specific with regards to COVID-19. So to decrease the spread of COVID-19, and we're already seeing that the numbers are not going in the right direction, this is the process by which they are letting people know that they may have been exposed to COVID-19, that they should monitor their health, for signs and symptoms, the signs and symptoms that we had just talked about, and that they might need to get testing. And in some cases, they're asking people to self-quarantine if they're in close contact with someone with COVID-19. Now, a really important point is that your health department may place a call to you specifically about contact tracing. But if someone from the health department, or if anybody for that matter, contacts you with regards to contact tracing, no one should ever be asking you for your social security number, for your bank information, for credit card information, or for money. So there is never a case where the health department is going to be asking you for those, for that type of information. So getting back to when we discontinue this isolation, this home isolation, because this can be quite challenging for a lot of people. So the guidelines at this time say that it should be at least 10 days since your symptoms first started. So all those signs and symptoms that we talked about, fever, cough, aches and pains. And you have to be at least 24 hours fever-free, but that has to be fever-free without fever-reducing medications. So without your Tylenol and your ibuprofen and your Aleve. And there should be an improvement in your symptoms. So that, the coughing, the shortness of breath. So all those things, if you have all three, then you can actually discontinue home isolation. So how about those people that have tested positive, have a confirmed lab test for COVID-19, but that are asymptomatic? So they can discontinue home isolation at least 10 days after the date of their first positive COVID-19 test. So next, let's look at prevention for both COVID-19 and influenza. So since both of these illnesses are respiratory diseases, there is overlap with regards to prevention. We know about staying 6 feet apart, making sure that we cover when we're coughing, when we're sneezing. When you have that tissue paper, make sure that you put it in the trash, wash your hands, keep washing your hands, make sure you continue to wash your hands. In public, wearing the mask, making sure it's over the nose and the mouth. Like I talked about earlier, making sure to not touch your eyes, your nose, or your mouth, because we're talking about the areas of mucous membranes where you could potentially have the virus get into your system. Cleaning and disinfecting all those frequently touched surfaces and objects. Also staying at home when you're sick, but making sure that you go out if you need medical care, that is important. And again, washing your hands often with soap and water for at least 20 seconds. So we cannot emphasize enough how important washing your hands, and that soap and water is very, very important. So question number 4, so true or false? If I get the flu vaccine, then I will be protected from both flu and from COVID-19. So this unfortunately is false, although we'll be talking about what we're doing in terms of vaccines for COVID-19 towards the end of the talk. So the protection that we have for COVID-19 involves all the things that we just talked about, actually for both COVID-19 and influenza. But in addition, the other thing to mention for both of these illnesses is to make sure that we're taking care of not only our physical health, but our emotional, mental health as well. So both of those systems need to be strong. With influenza, we are very, very fortunate because in terms of protection, we do have the flu shot as well. So that is a very, very important form of protection that everybody 6 months and older should be getting an annual flu shot. So our next question, so true or false? I have an egg allergy, so I cannot take the flu vaccine. And this comes up often. So this is actually false. You can still get the influenza vaccine. You're still eligible to receive age-appropriate influenza vaccine. For people that have severe egg allergies, the actual vaccination, it should be done in a medical setting. It should be supervised by a healthcare provider that's able to manage allergic reactions, but it is not something where because you've had an egg allergy that you cannot get an influenza vaccine. For people above the age of, or at age 65 and above, there are actually a couple of different flu vaccines that are available this year. The one is the Fluzone. It's the high dose quadrivalent, and it actually contains 4 times the amount of the antigens. So the antigens are the part of the vaccine that help your body build up that immunity, that protection to the flu vaccine, to the flu virus. So the Fluzone is an excellent choice. The other great choice is called Fluad quadrivalent. So the Fluad, so that add component is, there's an adjuvant in the vaccine itself. So there's an ingredient in there that actually helps to improve your immune response, because we know that people age 65 and older, that even when they get the flu vaccine, the regular flu vaccines, that they don't mount that immune response as vigorously as someone younger would. So these are great options for people that are 65 and older. The main side effects that people get from these two types of flu vaccines, they're really mild and temporary side effects. So a lot of times they'll get maybe a little bit of pain or redness at the site of the injection, maybe some headaches, some muscle aches, a little bit of malaise. But in general, most people have hardly minimal or probably no side effects as well from these vaccinations. And you cannot get the flu from these flu vaccines. And the reason that we talk about giving you protection is that, right now we don't know exactly how COVID-19 and influenza are going to interact. But if you get infected with both, it's likely going to result in a more severe disease. And we really are trying to avoid that perfect storm. So question 6, so true or false? Wearing a cloth mask will decrease the chances that I will transmit the coronavirus to someone else. So this is true, but one thing that we all have to remember is mask etiquette. And really it is important to know that the mask needs to cover both your nose and your mouth. As we had talked about, we need to get at those areas where you could potentially transmit the virus. It needs to fit snugly on the sides of your face, so you don't want to have any gaps on the sides of your face from the mask. With cloth masks, you want something that's washable, that's breathable. Really, you don't want something that's made of a fabric that makes it hard to breathe. So, something that's plastic, something that's vinyl, those are not masks that you want to be wearing. The problem with the valves and the vents that some of these masks have is that, unfortunately, people find that it's more comfortable to breathe, but it's also allowing the virus particles to escape. So that's why you should not be using a mask that has a valve or a vent in it. And then the N95s, they in general were asking those to be reserved for the healthcare workers, the people that are at higher risk. But that's also something that has come up in terms of questions on what masks I should wear. So this also kind of goes over some of the don'ts of mask wearing. We had talked about kind of the loose fitting, making sure that it's on your nose and mouth and not underneath your nose. Let's also just make sure that we're not using a mask that's damaged. Also, don't wear a wet mask or a dirty mask. Obviously, never wear a mask where it's really difficult to breathe through it. For instance, if it's made of the wrong types of materials. You do not want to be removing a mask if you are close to other people. And this is the time when you don't want to share. So some practical points in terms of wearing and removing your mask. Again, and we'll keep on going over this part with regards to making sure that we wash our hands with soap and water. That's always going to be important, both before and after we put on a mask, take off a mask. When you're putting on your mask, make sure that you're holding the mask by the ear loops and then place those loops around each ear. The top of the mask usually has a little metal wire in it, so you can mold that, pinch it at the top, and so that will give you a better fit in terms of the top of the mask along your nose. Then you're going to be pulling the bottom part of the mask over your mouth and your chin as well to give you a fit underneath the chin. And in both cases, when you're putting on a mask and when you're removing a mask, just make sure we're not touching the mask itself. So you want to minimize the amount that you touch the mask. If at all possible, just touch those ear loops. When you're taking off the masks, use those ear loops, gently take off the mask, throw the mask in the trash can, you're done with it, and then clean your hands again, soap and water, and a sanitizer, hand sanitizer, if you don't have access to soap and water. So some questions that have come up. So should I travel? So this is a big question. The reasons to delay would definitely involve if you're sick, if you've had COVID-19 testing and you're waiting for results, if you have had close contact with someone with COVID-19 in the past 14 days, or if you've recently tested positive for the virus. So those would be reasons that you definitely want to hold off in terms of travel. If you are going to be traveling, check the COVID-19 rates at your destination, including the requirements and restrictions, because this is changing daily. The CDC is a great resource with regards to where the statistics are, and like I had shown, the Johns Hopkins, they also have some great numbers and statistics, and they're also continually updating those numbers as well. Also, make sure that you're considering your risk for severe illness from COVID-19 before you decide to travel, as well as who you live with, because if your loved ones are at increased risk, then it might not be the best time for you to travel, because the last thing you want to do is get infected, even asymptomatically, and bring COVID-19 back to your household. If you do travel, you want to make sure to wear a mask. You want to make sure to socially distance and follow all the guidelines that we've talked about, and also make sure that you wash your hands often and use that hand sanitizer. So another question that people have is, what about the holidays? We have lots of holidays coming upon us. Ideally, we need to consider if a virtual platform would be something that would be reasonable. If you are going to get together, the safest thing would be to gather just with your own household. It's always important to look at the current numbers of local cases, look at the rates. So are things increasing or decreasing in terms of the cases, in terms of death, in terms of hospitalization? Look at the venues. So obviously it's hard for us here in St. Louis to be considering a lot of outdoor venues, but outdoor would be better than indoor. If you're going to do something indoors, then make sure that the ventilation is adequate. You do not want a place with poor ventilation. Consider the number of people that you're having. The smaller number of people, the better. And also consider where your guests are traveling from. So are they coming from an area where there's a high rate of COVID-19 cases? If you are going to do a gathering in general, small gatherings are best. Follow the social distancing guidelines. The masks are important, and really no sharing of objects, foods, and drinks. So what is on the horizon? So what are we looking at for the future? So the COVID-19 vaccine trials. So there are actually 154 preclinical trials that are in the process right now. Phase 1 trials are the small scale safety trials. Phase 2 are the ones that are expanded to hundreds of people. Phase 3, they're actually looking at the large scale studies. They expand to thousands of people. They have some people receiving placebo. They're looking at safety, efficacy, dosing, as well as side effects. And limited use are, with some countries, they are actually approving limited use vaccines without the results of all the phase 3 trials. And these are the numbers of the different types of trials that are currently in process. There are no approved COVID-19 vaccines in the United States at this time. Uh, Questions that you may have, the COVID-19 vaccine, these will not give you COVID-19. So they are not live attenuated viruses that are being given in vaccine form. The vaccines in the clinical trials here in the US, they will not cause you to test positive on the viral tests. They may cause some positive tests with regards to the antibody tests that we talked about, but that's also, they're still kind of in the process of figuring that out as well. And the post-acute COVID-19 is another area of research, of developing research at this point. It's also known as long COVID, and some people are referring to it as long haulers. And what it's thought to be is a multi-system disease that it seems to occur even after some relatively mild COVID-19 disease. They think that approximately 10% of people are experiencing a prolonged illness after COVID-19. And the definition of that is if you're still having symptoms after 3 weeks from the start of the illness. And some of the complications are pretty serious. Some are very non-specific. What we're seeing is some people are developing cough, low-grade fevers that are continuing, and fatigue. But some people are having continued shortness of breath, chest pain, headaches, neurocognitive difficulties, muscle pains and weakness that are continuing, gastrointestinal upset. There are rashes, there are metabolic problems, thromboembolic, so clotting problems, and also mental health issues as well, including depression. The good news with regards to what they're seeing right now in terms of post-acute COVID-19 is many of patients are recovering with support, with rest, with symptomatic treatment, and with gradual increases in activity. But this is really a developing area of research right now. The most important thing is close medical follow-up, really keeping in contact with your healthcare provider throughout the course of your illness. So to summarize, these two diseases, influenza and COVID-19, they are caused by two distinct viruses. Transmission, it's similar, as are a lot of the symptoms. COVID-19 is more contagious, and it's contagious for a longer period of time. Prevention is important for both, but the additional point with regards to prevention of flu is that flu shot, which everybody should be getting. And finally, it's really important to stay in contact with your healthcare provider. So this looks like a really busy slide, but it does have a lot of resources that are helpful with regards to both COVID-19 and influenza. We actually have through St. Louis City, St. Louis County, as well as the Missouri Department of Health and Senior Services, they have hotlines that are available for questions, concerns that you may have. So they can be another resource in addition, obviously, to your healthcare provider. CDC is an excellent resource for information, including the coronavirus self-checker. Johns Hopkins, the Coronavirus Resource Center, also excellent for the data. There are COVID-19 public testing sites, and I have that listed as a website as well. There are some free flu shots that are available through St. Louis City. And the CDC website is great, not only for COVID-19, but also for influenza. So I really think that for questions that they can be very, very helpful for people. And finally, just in general, a lot of us go to the web for getting our information. And we want to make sure it's accurate and credible information because there are so many different sites out there. And the University of California, San Francisco, their website actually has a section for evaluating health information. So I would strongly encourage you to look at that because it really kind of helps you navigate to see, is this site that is talking about COVID, is this real information, or is this something that I shouldn't be looking at? So that's another resource that I think would be very helpful. This is a list of some of the references from my talk. And I want to thank you all for your time. Stay safe, stay well. And if there are any questions, I'd be more than happy to help.
Dr. Sakurai, there's a question about from Marcia. Can you take Advil with COVID?
That's a really good question, Marcia. So people were worried about nonsteroidal anti-inflammatories in COVID. And at this point, it looks like things like Advil and Aleve. So Aleve is naproxen. Advil would be the ibuprofen. But it looks like those are actually safe to use in terms of symptomatic treatment.
So if anyone has a question, you can raise your hand, you can chat in the chat box, or if you just want to unmute yourself and ask a question, that's acceptable as well too. So not seeing.
Just wanted to say it was an excellent presentation. Thank you so very much.
Oh, thank you so much for your time.
Weber, do you have a question?
Yes. I went to get a flu shot at my internist's office, and you were in his office years ago. Even my daughter was your patient.
Oh my gosh.
And so I had it about 11:30 on a Monday, about a month and a half ago. About 7 o'clock Monday evening, my hands started trembling terribly.
Oh my.
And I was bitter cold and my eyes hurt, so I knew I had temperature.
Sure.
And I had 100-degree temperature. So about 9:30 that night, I called up the pharmacist at Walgreens and I told him what was going on. And he said, well, it sounds like you're having a reaction to the flu shot. And then the next day I called my internist's office and Zamir. And I got a call back from Precious telling me that I should go to the hospital and get tested. I said, no, I'm staying in bed. And I was a little worn out. I was in bed all day. Tuesday, Wednesday, I felt draggy, but Thursday I was peppy. Then I went back about a month later to get another B12 injection. And I said, I had a reaction to the flu vaccination. She said, one of the girls in the lab said, yes, we've heard a lot about that reactions. I have never had a reaction to anything like that. Sure.
Well, and every year the flu vaccine changes. So it could be that particular year that it was something where the way it was created, there was a substance within it that caused you to react.
Right.
Well, yeah, that's really tough.
I was in the H1N1 study at St. Louis University several years ago. I think it was 2008. And then I have an appointment. I saw it on the internet and I responded and I answered the questions. They called me back. So I think it's the 20th. I go for a session there for COVID.
Oh my.
I don't know where my email is on it now, but they told me come in and talk to them. So they need all ages, she said, for that. So
we'll see. They do with a lot of these trials. They want people that are 65 and older, because we need to figure out, what's going to work for the older population, what's going to work for, middle-aged adults. So really, I mean, that's tremendous for you to help out, because it's going to make all the difference in terms of trying to find, a cure and prevention for this horrible, horrible disease that we are globally experiencing.
Well, I was compliant in my last study. I had to check my injection site, take my temperature, things like that. So
Sure.
we'll see what'll happen. I hope they won't refuse me. I told her I've had cancer, and she said that's fine. Because a lot of trials I can't get into.
Sure. No, good for you. Thank you so much for helping us.
We have time for one more question, and I think Weber, you have a question?
Yes, I noticed on one of your slides regarding remdesivir, you said if it cannot be used, they would use dexamethasone.
Dexamethasone.
Yeah, why wouldn't somebody be able to use remdesivir?
Sure. It's probably related to, say if someone had an adverse reaction, if they had an allergy to the medication itself. So either if they had a reaction to the medication where they couldn't continue the medication, or if they, had a problem with, the substances that make up the medication, maybe not the active ingredient, but some of the inactive ingredients. So if that was the case and you couldn't use the antiviral, then they could potentially just use the dexamethasone. But recall that the dexamethasone, I mean, it's a steroid. So it's kind of, it helps. I mean, it's basically an anti-inflammatory medication. And it's helpful, hopefully, to decrease the body's response to the virus, so that the bad effects of what the virus is doing to the body. But it's not a cure for the virus itself. It's trying to help treat the symptoms, treat the disease, the COVID-19 disease, but it won't. It's not going to kill the virus itself.
Well, thank you so very much, Dr. Sakurai. We really appreciate, this is wonderful information, and I've had a couple of people ask if we can share your slides. And so I'm going to send your slideshow to their emails. Is that a good?
Absolutely. Yeah. I mean, my whole point is to make sure that we educate the community. So if any of the slides are helpful for you, then please, by all means.
Okay, great. And also I want everybody to know that it is going to be, I did record this today, and it will be available on the Miro at Center website in a couple of days after I get it processed. So if you need to see it again, you're welcome to see it again, or if you want to tell a friend about it, that would be great too. And thank you so very much. We really appreciate your time today. And thank you, everyone.
My pleasure. Thank you all for your time.
Okay, thank you. Bye.